Welcome. My name is Angie Galarakis, Resource Coordinator for the Greek Orthodox Archdiocese Center for Family Care. We are so glad you could join us to hear Dr. Evgenia Litrivis speak today. The title of her presentation is Golden Rules for the Golden Years, Resources to Help Reduce Symptom Burden and Caregiver Burnout in Older Adults. Before we get started, there are a few details of this webinar I'd like to go over. This workshop is being recorded and will be available for viewing about a week from now. We will notify people on our Facebook page and through our email list when it is going to be posted. You can sign up for that email list and like our Facebook page from our website at www.goarch.org. You can ask questions during the presentation by clicking the Q&A box and typing in it. Questions can be anonymous if you like. We will do our best to get all the questions answered, and of course it will depend on the number of questions we receive as to how quickly we can answer you. As always, we would like to thank Leadership 100 and faithful stewards like yourself, whose generous donations make these webinars possible. It is an honor to introduce Dr. Evgenia Litrivis. Dr. Litrivis is a board-certified internist, geriatrician, and palliative care physician. She completed her residency and fellowship training at the Mount Sinai Medical Center and stayed on faculty there for several years. She is a John A. Hartford Foundation and American Federation of Aging Research Center of Excellence Scholar for 2012 and 2013, and is a recipient of a Geriatric Academic Career Award grant. She is currently raising her daughter in Connecticut, where she resides with her husband and is a member of Archangel's Greek Orthodox Church. Thank you for joining us, Dr. Litrivis.
Thank you, Angie. Thank you for that introduction. It's such a pleasure to be here with you all today, speaking on golden rules for the golden years. So let's start by looking at some facts on the aging population. Worldwide, average life expectancy is increasing, and older adults are living well into their 70s, 80s, and 90s. And with this increase in life expectancy comes an increase in chronic disease development. And many older adults are going to acquire one or more chronic illnesses that they will live with for several years. And as this disease progresses, many of these years will be marked by physical discomfort, pain, and other symptoms, psychological and social stress, increased disability and frailty, and eventual need for caregiver support. So the question that I want us to explore today is, given these facts, what healthcare resources are available to decrease chronic disease burden, improve older adults' quality of life in an effort to make these years the true golden years? And we're going to address this question by looking at several topics. The first topic is going to be palliative care, and we're going to try to dispel several misconceptions about palliative care and see how palliative care as a resource can help older adults facing serious age-related chronic disease. Then we're going to look at the important role caregivers play in supporting older adults and certain strategies that have been proven to help mitigate caregiver burnout. We're going to explore advanced directives and how having completed an advanced directive empowers you by ensuring you receive the type of care you want at end of life. And we're going to do all this within the context of exploring dementia, a chronic progressive disease that is under-recognized. And because it's under-recognized, many individuals facing a diagnosis of dementia and their families often don't have access to the same supportive services as individuals facing other serious illnesses. And we're going to do all this while following along in the course of a lovely woman named Mrs. A. So let's dive right in. Mrs. A is an 83-year-old woman, and she has Alzheimer's dementia. And her primary caretaker is her husband. Mrs. A also has high blood pressure and osteoporosis. And she's been hospitalized now for 3 days with a severe case of pneumonia. And her hospital course has been a complicated one. She's had periods of confusion, moaning, and agitation witnessed by both the medical and nursing staff. And she's pulled out her IV line 3 times, requiring restraint. She's also found to have a fracture in her vertebral body, which is a bone in her spine, thought to be caused by weakening of her bones from her osteoporosis and the severe coughing she did related to her pneumonia. So Mrs. A is having a pretty rough hospital course. So what can we do to help Mrs. A get through this hospitalization? So we're going to start by discussing palliative care, and we're going to see if palliative care has a role in Mrs. A's care. So palliative care is a fairly new medical subspecialty that aims to relieve suffering and improve quality of life for patients facing serious illness and their families. And palliative care aims to improve quality of life by addressing several domains. And the first is symptom management. So many patients with serious illness have symptoms related to the underlying disease itself or treatments aimed at helping cure the disease. Things like pain, shortness of breath, nausea, vomiting, constipation. And patients with serious illness report undertreatment of these symptoms and an overall poorer quality of life as a result. And so palliative care teams have members who are experts at identifying these symptoms and come up with treatment plans to address these symptoms. So that's the first thing palliative care teams do. Then appreciating that many patients feel that there's really poor communication amongst healthcare providers, particularly in hospitals, palliative care teams make communication a priority. And they empower patients by making sure that patients receive as much information as they need to fully understand their disease, understand what to expect going forth in their disease process, and truly appreciate the pros and cons of medical decisions so they can make the most informed medical decisions going forward. So palliative care helps address communication as well. Then appreciating that chronic and serious illness brings upon a host of stressors, both in the forms of psychosocial stress, existential suffering. Palliative care teams try to help patients, and not only patients, but their families as well, by providing psychosocial support, religious and spiritual support, as well as practical support by means of helping set up safe home discharges and ensuring safe coordinated discharges from hospitals to other care settings. So they do a lot by way of helping provide support. And they appreciate that illness not only affects an individual, but an entire family unit. So they offer this support not only to the patient facing serious illness, but also to the family unit as a whole. And then as patients progress along an illness trajectory, palliative care is there to help patients who are actively dying and help segue them into hospice care. So because palliative care does so much, it truly does involve a whole team to make sure that all these domains are properly attended to. So depending on where you meet a palliative care team, you may see different members, including doctors, nurses, social workers, spiritual care counselors, massage therapists, physical therapists, dietitians. The team can be fairly large or small depending on which hospital you're at and where you meet them. But it does truly involve a whole team to make sure that all those domains are addressed. So because palliative care is a fairly new medical subspecialty, I as a palliative care physician often hear about many misconceptions that individuals have about what palliative care is all about. And that's understandable. And the first misconception is, I thought palliative care was what we do when there's nothing more the doctors can do. So when all disease-directed therapies have been exhausted, then you call in palliative care. And that couldn't be further from the truth. That's not what palliative care is all about. Palliative care is actually best and can actually improve quality of life the most if it is offered simultaneously with all other appropriate medical treatment, ideally at time of serious illness diagnosis, regardless of what a patient's underlying prognosis is. So it doesn't mean that you get either disease-directed therapies or palliative care. Palliative care works best if you get both palliative care and disease-directed therapies at the same time. Another misconception is I thought palliative care was the same as hospice care. And no, that's not true either. Palliative care extends beyond end-of-life care and helps people living with chronic serious illness. So let's explore a little bit further the differences between palliative care and hospice care. Palliative care can be provided at any time along a patient's illness trajectory, but best if started at time of diagnosis. So it's for patients living and facing serious illness. Hospice care, on the other hand, is a care that is provided to the terminally ill, to patients who are dying and typically have a prognosis of 6 months or less. So it's limited to those who are dying. Palliative care is care that patients receive at the same time as efforts to cure or prolong life, whereas hospice care is for patients for whom curative-oriented therapies are no longer indicated, their burdens far outweigh their benefits, and individuals on hospice care are seeking maximal comfort support. Palliative care is expert care of pain and symptoms throughout illness, and hospice care, on the other hand, is expert care of pain and symptoms specifically at end of life. So hospice care is really restricted to end of life, whereas palliative care transcends the illness trajectory. So how can palliative care help? So it has been my clinical experience, coupled with what large amounts of data show, that palliative care improves patients' overall quality of life. And it does this through several means. And the first is by helping reduce distressing symptoms. And by reducing things like pain burden, shortness of breath, patients who are facing serious illness can go out and live their lives, and it also helps patients get through the treatments they need for their underlying serious illnesses. So it really does great things to help improve patients' overall quality of life. It also has been shown to improve communication, thereby empowering patients to better understand their serious illness and to informally make medical decisions by having the most information that they need so that they can truly weigh the pros and cons of their medical decision-making moving forth. Palliative care also provides great support, not only to the patient, but to family members as well. And it is truly a holistic discipline which treats the entire family unit. Then when we look at families, palliative care has also been shown to improve family satisfaction and overall well-being. And it does this by several mechanisms as well. It helps provide practical support for family members. So it helps them with setting up things like home discharges and ensuring that discharges home are safe. It also provides psychological, religious and spiritual support to family members, and it has also been shown to reduce depression and prolonged grieving among family members by providing both grief and bereavement support after a loved one has passed away. So to further explore this, this was a very interesting study that recently came out where patients who were diagnosed with metastatic lung cancer were randomly assigned to either receive standard cancer care and treatment or standard cancer care and treatment in addition to early palliative care. And what this study showed was that patients who received standard cancer care plus early palliative care actually had lower rates of depression and improved quality of life and mood scores. And then in addition, those same patients who received standard cancer care plus early palliative care had longer survival rates than patients who received standard cancer care alone, despite receiving less aggressive care at end of life. So there's something that palliative care does that's truly good for the patient. So then the question becomes, can palliative care help you? And these are some examples of some serious age-related illnesses that palliative care can assist with, especially if you are suffering from these illnesses and have a symptom burden that has not been treated or has been undertreated, or feel like you have communication needs that have not been addressed, or have or are in need of support. And these illnesses include, but are not limited to, congestive heart failure, COPD, including emphysema, liver failure, kidney failure, neurological diseases, including dementia, ALS, MS, and cancer. So those are some examples of age-related illnesses that palliative care can assist with. So let's go back to our patient, Mrs. A, and see what palliative care can do for her. So on the third day of her hospitalization, a palliative care consultation is called to evaluate Mrs. A's moaning. And the palliative care physician assesses that Mrs. A is experiencing a fairly significant amount of pain related to that fracture of the bone in her back. The palliative care physician prescribes a pain medicine, and Mrs. A's moaning subsequently stops. Her confusion and agitation also improved, and the thought was that those were likely related to her uncontrolled pain. She now can rest comfortably in the bed, and she no longer requires restraints. The palliative care physician also makes sure that Mrs. A has a bowel regimen to ensure that she doesn't get constipated related to the pain medicines, and she tells Mr. and Mrs. A that more members of her team will return to meet them both in a little bit. So palliative care really did help Mrs. A. And if you want to know more about palliative care or feel that palliative care could help you or a loved one, these are some online resources where you can get additional information. And so those are there for your viewing. So that was our first resource that could really help reduce symptom burden and help improve older adults' quality of life. Let's now shift gears and focus a little bit about caregivers. So the healthcare system relies heavily on caregivers. They rely heavily on caregivers to support our older adults, to help in assisting the implementation of medical plans, to help older adults with daily activities. There's just so much that caregivers do. And caregiving in general can be a really positive and rewarding experience, but it's riddled with a lot of stress, and as such, it can be quite challenging. If you look at some statistics on caregiving, it's quite alarming. 1/4 of all caregivers stop working in order to provide care for a loved one. 1/3 lose a majority of their finances while trying to care for a loved one. And family caregivers who report stress are at increased risk for heart attacks and overall mortality. So caregiving not only affects social stress and finances, it affects your overall health and well-being. And the stress that caregiving poses on someone, the emotional, physical, mental, and sort of spiritual exhaustion and stress that it causes and takes its toll on someone is known as an entity called caregiver burnout. And it's important to recognize caregiver burnout because there are several ways that it can be alleviated. And some signs of caregiver burnout include mood changes, things like depression, irritability, anxiety, feelings of guilt over wanting to do something to take care of yourself rather than taking care of the individual you are responsible for, having changes in your sleep patterns, changes in your appetite, socially isolating yourself and losing interest in activities that you once found enjoyable. And in its most extreme form, caregiver burnout can cause individuals to have thoughts of wanting to hurt themselves or to hurt the person for whom they are caring for. And I just want to say that if you are experiencing those thoughts, it's really important to share those thoughts with a physician, with a doctor, with someone you trust so that you can get the help that you need. And those thoughts can be temporary and can be helped. And so caregiver burnout is a serious entity. And there are certain risk factors for caregiver burnout. Spousal caregivers are actually at increased risk for caregiver burnout as compared to adult children who are caring for aging parents. So somebody like Mr. A, who is caring for his wife, Mrs. A, is at pretty high risk for caregiver burnout. Additional risk factors for caregiver burnout is being a female, and most caregivers in general tend to be women, living in the same household as the individual you are caring for, isolating yourself socially. And it's really hard because caregiving consumes so many hours of the day, but socially isolating yourself and not having a strong social support network puts you at increased risk for caregiver burnout. Having a lower educational level, particularly because that sort of corresponds with your understanding of the underlying illness for the individual for whom you are caring for, and not really understanding the disease that you are helping the individual get through, oftentimes is accompanied by unreasonable or unrealistic expectations for what the disease course can be, and that can lead to caregiver burnout. Increased caregiving hours, and feeling like you've had no choice in the role of caregiving. Those are all risk factors. So what are some proven strategies to help mitigate or reduce caregiver burnout? So one of the first things that is really important to do is just recognize what caregiver burnout is. And unfortunately, it is my opinion that the healthcare today and the healthcare community really does a poor job of supporting caregivers and ensuring their overall health and well-being. And caregivers, unfortunately, are often neglected by our healthcare community. So it's important for caregivers, number one, to recognize what caregiver burnout is and to really seek help if they feel like they are suffering with caregiver burnout. And one of the ways, though, that you can really help reduce your rate of getting caregiver burnout is self-care. And that sounds much easier said than done, but actually taking the time and allowing yourself the permission to take the time to take care of yourself is so vital in caregiving. And I know that caregiving consumes so many hours of the day, but even if one takes 20, 30 minutes a day to do something that they find enjoyable. For myself, I enjoy listening to music and going on brisk walks. So just to take 20 minutes a day to decompress and give yourself that mental break that you need to do something to recharge, because caregiving truly is a marathon and you need your stamina to get through it. And the way you can help yourself get through it is by taking care of yourself every day. An additional way to help reduce caregiver burnout has been shown to be support groups, particularly support groups for family members who are taking care of care recipients who have the same illness as your loved one. So there are caregiver support groups for dementia, caregiver support groups for cancer. Support groups have been shown as really helpful in helping decrease rates of caregiver burnout because they help you be established within a social support network. And by speaking to other individuals who are taking care of people who have a similar illness as your loved one, you may pick up tips of the trade or strategies to figure out how to deal with certain situations. The support groups have been found to be really helpful. But going beyond support groups that actually have educational sessions tailored to the illness that your loved one has been found to be really instrumental in helping reduce caregiver burnout. And knowledge is power. So the more you know about the underlying illness that your loved one is suffering with, and the more you know about what changes to expect going forward, the greater preparedness, the greater sense of preparedness you have as a caregiver, the lower the rates of caregiver burnout. Family help has also been found to be really instrumental in helping reduce caregiver burnout. And oftentimes what caregivers do is they feel that their sole responsibility is to be a caregiver. And if family members offer to help, they will often say, oh, no, thank you, I've got everything under control. But it's important when that help is offered to actually take up individuals on that help so that you can take the time to decompress and to take care of yourself. Other proven strategies is by enlisting the help of a local social worker to make sure that you've exhausted all potential home support services that you are eligible for. Things that you may be eligible for that may be helpful include transportation, meal preparation, home physical therapy, home visiting nurse services. There's a lot of home support services that may be of benefit that would help lessen the burden of caregiver burnout. Respite care is often an underutilized resource that can be very helpful, and respite care takes two forms. One form is by enlisting the help of a temporary caregiver to come to the home to give you a break for a couple of days, and that individual would care for your loved one. I have not very much seen that done clinically in practice. What I tend to see more of is a loved one is admitted to a long-term care facility for a couple of days or a week or so, giving the primary caregiver a break and a time to recuperate and to recharge. Prayer has been found to be very helpful as well in helping caregivers get through difficult situations and just in general overall trust in God. This has been particularly helpful in caregivers of individuals who who have dementia. And symptom relief for the care recipient has been found also to be very helpful in diminishing the incidence of caregiver burnout. If you are caring for someone and you feel that that individual is suffering or has uncontrolled pain, shortness of breath, some sort of symptom that you really cannot get a hold over, that's really going to be very distressing to the primary caretaker, and that's been shown to really compound the effects of caregiver burnout. And so palliative care can come in that situation and help alleviate some of those symptoms. In addition to helping with symptom burden, palliative care clinicians have been trained to recognize caregiver stress, and palliative care as a discipline has been shown to improve overall caregiver well-being and family satisfaction by helping link caregivers up with local resources and support groups. And so let's look at what happened to Mr. A and how palliative care helps Mr. A. The palliative care nurse, social worker, and chaplain returned to check on Mrs. A and to meet Mr. A. Mrs. A is improving from her pneumonia and she appears comfortable. She has, however, become quite weak during the hospital course and can no longer get out of bed unassisted. And on assessing needs for home care, the team suspects that Mr. A is experiencing caregiver burnout. He himself has several medical conditions, including asthma and heart disease, and it is becoming harder for him to care for Mrs. A. Mr. A actually cries when he shares with the team that he is worried about Mrs. A's new care needs. The palliative care team referred Mrs. A for evaluation for rehabilitation services and for home care, and they also refer Mr. A to caregiver support groups. And here are some additional resources whereby caregivers can find some local support groups as well as find some local elder care services that their loved ones may be eligible for. We're going to now turn our attention to advanced directives and discuss advanced directives and why advanced directives can be a helpful tool in your pocket to also help you navigate the healthcare system and ensure that your end-of-life care is in concordance with your underlying wishes. So advanced directives are either oral or written instructions that describe what type of treatment preferences you have in the event that you are unable to make medical decisions on your own behalf. And they only come into play if you yourself cannot communicate and cannot make your own medical decisions. And they're basically used to tell doctors and family members what your preferences are for medical treatment. And there are many, many different forms of written advanced directives, but the most widely recognized forms are known as living wills, healthcare proxies, and then depending on various states, healthcare proxies may actually be known as durable power of attorneys for healthcare, and then a combination document, which is usually a living will with a healthcare proxy portion attached to it, so a combination. So what exactly is a living will? A living will basically is a form of instructions that tells the healthcare community and your family and loved ones what you would want at the end of your life should you lose your ability to make decisions on your own behalf. And many, many people have every intention of completing a living will, but time gets the best of them and they don't ever get around to doing it. So it's important, particularly if you are diagnosed with a serious illness, that you take the time early on to sit down and to really think about what are your goals, what are your values, and what type of medical treatments are aligned with those goals and values, and actually complete a living will. A healthcare proxy, on the other hand, is someone that you appoint to make medical decisions on your own behalf, again, should you lose decision-making abilities. And that's who the healthcare team would turn to speak on your behalf. And some tips of the trade are that your healthcare proxy should be someone, A, that you trust to make serious decisions, B, someone who clearly understands what your wishes are and with whom you've actually had discussions regarding your wishes, and C, someone willing to accept the responsibility. And it's often surprising to me how many times I will contact the healthcare proxy to let them know of a loved one's illness, and the healthcare proxy doesn't know what their loved one's wishes are. So to actually complete a healthcare proxy is step one, but to actually sit down and have those discussions with the healthcare proxy about what your wishes are is really, really crucial. So then the question becomes, well, why complete an advance directive? One of the biggest reasons is because it empowers you as a patient. Doctors do not know what your wishes are for your end of life. And doctors want to respect your autonomy and want to make sure they provide medical treatments that are concordant with your wishes. And so having an advance directive really ensures you and empowers you to know that you will receive the types of treatments that you want at end of life. And the doctors don't do anything that you wouldn't want them to do. And then another major reason to have completed an advance directive is because it really helps alleviate a lot of family stress and decisional burden that family members feel about making decisions for loved ones at end of life. Choices at end of life can be quite overwhelming, can be very complicated, and the situation is already super stressful. And I have personally too many times seen major discord amongst family members and just real disagreements between loved ones who have every intention of doing what is right by mom or dad or by brother or sister, and really feel passionate about what they want for their loved ones. And they are all well-intentioned, all these family members, but because they don't know what their loved one wishes are, this can cause a lot of disagreements among family members. And so having an advance directive laid out with clear instructions not only alleviates family members' decisional burden, but they want to do what's right by you, and they may just not know what your wishes are. So having this really alleviates a lot of stress at end of life. And certain healthcare decisions, these are some examples of decisions that could be included in an advance directive. They can include orders regarding wanting a natural dying process or having a do not resuscitate orders. They can include wishes regarding life support, things like what your wishes are about breathing machines, wishes regarding artificial nutrition and hydration, your preferences regarding organ donation, and some people include funeral arrangements in an advance directive as well. And an advance directive does not by any means need to include all of these, but these are just some examples of some things that individuals can include in an advance directive. After having completed an advance directive, it's really important that you just don't put it in a safety deposit box and forget about it. I've seen that as well. You want to review the contents of the advance directive regularly, make sure your wishes are concordant with what your wishes were years ago or whenever you completed it. You want to encourage the accessibility of these documents. So again, you want your loved ones to know where these documents are. And you're going to want to make copies of these documents for your physician and for your healthcare team, so they're aware of what your wishes are as well. So let's return to Mrs. A and see what's going on with her. The palliative care doctor returns to check in on Mrs. A. Mr. A shares that upon arriving to the hospital, the doctor had asked him if he knew what Mrs. A's, quote, code status preference was. But Mrs. A was delirious. So Mrs. A was confused, delirious, could not share her thoughts or her decision-making at the time, and the doctor had asked Mr. A what his wife's preferences were regarding cardiopulmonary resuscitation. And Mr. A was overwhelmed, naturally, and he couldn't answer the doctor. And on returning home, however, he found legal documents that his wife had completed upon receiving her diagnosis of dementia. And he shows the palliative care physician the document and asks if this is what the doctor had needed. And on receiving Mrs. A's consent, the palliative care doctor sits down with both Mr. and Mrs. A, reviews her living will and healthcare proxy with them. It names Mr. A as her primary healthcare proxy and her niece Angela as alternate agent. Mrs. A acknowledges that her wishes remain the same, and Mr. A feels relieved that he is aware of what Mrs. A's wishes are regarding her future care. So a lot was learned from that conversation with the palliative care doctor, and it was great that Mr. A was able to bring in her living will and her healthcare proxy forms. Again, these are some online resources where you can learn more about advanced directives. And many of these websites also have areas where you can plug in the state that you live in, and you can download living wills and other advanced directive forms that are particular to your own state. And then so lastly now, we're going to turn our attention and we're going to focus in on dementia. And as I had mentioned earlier, dementia is a chronic progressive disease that is often under-recognized by the healthcare community and also by the general population, because there are a lot of misconceptions about what dementia is all about. And currently in the US, there's about 5 million Americans who are affected with dementia, and because of population aging, that number is expected to really exponentially increase. So given that, we need to figure out as a healthcare system how we can best address the needs of these individuals as well as their caretakers. So what is dementia? Dementia is a global term that basically describes an irreversible decline to one's mental or thinking abilities, and it has to be severe enough that it affects one's ability to carry out daily activities. And it is caused by damage to brain cells, whereby brain cells can't communicate with one another properly. And so because the brain cells, depending on what type of dementia you have, can be located in different parts of the brain, it affects more than just your memory alone. So the question then becomes, isn't it all just aging? That is perhaps the biggest misconception about dementia, that dementia is just a disease that happens with aging, and that it's something that only affects memory. And because it's global deterioration of your thinking abilities, it definitely affects more than just memory. And yes, age-related memory changes occur, but they are not severe enough that they affect one's daily functioning. And dementia is not a normal aging process, so it's not something to be neglected. So what can dementia then affect? It can affect a lot of things. And as I mentioned earlier, it affects your thinking abilities and mental abilities in various ways. So the first is it can affect your ability to acquire new information. So things like remembering doctor's appointments. New information is harder for you to remember. It can affect your visual spatial abilities. And so if you're driving and you have dementia, you may have a difficult time thinking about distances and judging distances. And so it can cause just poor driving overall, and in its worst cause, it can cause accidents. Dementia can affect your language, and you can have difficulty finding the correct words or names for things. It can affect reasoning and judgment, and so you could have difficulty with things like balancing your checkbooks or keeping your finances in order. Dementia can affect personality, and it can cause behavioral changes. And so one could note that somebody with dementia now has developed general apathy or lack of interest in activities and things that they were once interested in, can have depression, anxiety, can start to develop paranoia. A lot of changes come along with having dementia, and dementia can affect your orientation. And so you may have a difficult time with dates, months, days of the week, seasons even, so it can affect your overall orientation. And dementia is sort of a global term, and there are many different forms of dementia, and the most commonly recognized form and the one that occurs the most frequently is Alzheimer's dementia, and more than 50% of all cases of dementia are Alzheimer's dementia. And then you can have vascular dementia, which occurs sometimes after having strokes. And there are various different forms of dementia. And so can you prevent dementia? There's a couple of things that you can do. And the first is maintaining your cardiovascular health. And so your brain is nourished by blood that goes through blood vessels in your body. And so making sure those blood vessels are free of cholesterol, don't have the stress of high blood pressure. These are all ways you can help minimize your risk of cognitive decline. And then engaging in regular physical activity has been shown to decrease rates of cognitive decline, as well as eating healthy and engaging in things like a Mediterranean diet, or a diet that's high in healthy grains, fish, oil, fruits, vegetables. All of these are ways to help prevent cognitive decline. So if you suspect, or if a loved one suspects that you may have issues related or changes related to a possible diagnosis of dementia, what should you do? It's important that you recognize first and foremost that these are that you should get a checkup, because an early checkup can help first and foremost rule out possible reversible causes for changes in memory. And these reversible causes are small in number and don't happen frequently, but if you have a potentially reversible cause, it's important that it be addressed. So these include things like vitamin deficiencies, thyroid disorders, structural brain disorders. It's important that those be checked out and we make sure that those are ruled out. And even if you don't have a potentially reversible cause of memory decline and changes in mental thinking and ability, it's important to get a diagnosis of dementia early, because that will help you see if you are a candidate for potential treatments, for helping get your affairs in order, for linking up with support groups and possible clinical trials. And what would happen if you go to a doctor for a checkup is the doctor would perform a history, ask you what changes you have noted. A doctor may ask you for your permission to have a loved one also come in, or a family member come in, and also discuss what changes they may have noticed. And then an examination would be performed, and this examination would include now memory and mental testing. You would get laboratory testing done, performed, possibly to rule out those reversible causes, and the doctor may or may not perform a brain scan, a CAT scan, or an MRI, depending on what he or she finds on physical examination and by history taking. And so you can go to a general internist, a family physician to do this testing, but a family doctor or a general internist may feel more comfortable by referring you to a specialist, or he or she may do the testing themselves. And so specialists that can do this testing include geriatricians like myself, neurologists, neuropsychiatrists. And so all the different forms of dementia go through different stages. And Alzheimer's dementia, which is the most common form of dementia, these are the stages associated with that. And it's important for caretakers in particular to appreciate what these stages are, so that they can know what changes to anticipate, so that they can best deal with them. And in the early stage, one would note changes in recent memory acquisition, and an individual may start to develop personality changes, and they may have a hard time doing certain things that they once could do, like paying bills, going shopping, preparing meals. And as the dementia progresses in the middle stage, you'll notice changes in more older memories. And so it is at this point that one may have difficulty recognizing family members and friends. And then much more basic activities of daily living become impaired, and individuals will need help with things like toileting and dressing. Wandering becomes more of an issue, and personality changes. And in the late and end stage, an individual is completely dependent for all activities of daily living, has lost their ability to communicate, and may start to develop swallowing issues as well. And so the patient and caregiver, as they progress through the stages, different needs are going to arise with each stage. And in the early stage, it is most important for the patient to really sit down and to plan their affairs and get their affairs in order, to do things like making sure their advanced directives are completed and their financial and legal affairs are tended to, and that an individual continue to follow up with regular medical doctor appointments. And it is at this point that one may really benefit from memory aids, things like clocks to help with orientation, calendars to help with days and season. And for the caregiver, the role at this point is assistance with chores around the house and ensuring that home safety is attended to, as well as providing support to their loved one. In the middle stage, a caregiver safety becomes of a much more paramount issue, and the caregiver would have to work with a local social worker to make sure that home safety assessments are performed. A caregiver can seek out local resources, support groups, take the time to care for themselves and to get help from family, and to really sit down with doctors to formulate comprehensive medical plan and to learn more about the disease process and what to expect going forward. But to always remember to take the time to also do something for yourself during the day, to give yourself that permission to care for yourself. And in the later stage, the focus really becomes on maintaining quality of life, and by helping your loved one by doing things that they were once really interested in. So you can read to them their favorite portion of a book, or if they enjoy listening to music, play music for them, things to help them continue with stimulation. And the care needs at this point are going to become really, really great. So it may be time to decide where the best location of care should be. Should it be home? And if it is home, have all home care services been maximized? If it is in a long-term care facility, to receive help from local social workers in helping your loved one get into a long-term care facility, to make sure that advanced directives at this point have been reviewed, that medical teams are aware of them, that you've made copies. And it is at this point that caring for someone can become really overwhelming. So I cannot stress enough how important it is to make sure that your social support network is really tight, that you get help from family, and that you take the time to take care of yourself, because this is really a rough road for caretakers. And so some potential future directions, exciting new directions for dementia are underway. And the first is just an increase in the healthcare community of appreciating caregivers and realizing that we need to reach out to them more and make sure that they get the education and the support they need to care for individuals facing dementia. There's been incredible progress in understanding normal brain function and the brain function of those with dementia. And given that, there's many exciting new clinical trials underway for potential drugs to help reverse signs of dementia. So that's all very exciting and in the pipeline. So then just to follow up and close with Mrs. A and see what happened with her, Mrs. A is scheduled to see the palliative care nurse in the outpatient palliative care practice for follow-up after her rehabilitation stay. She's accompanied by Mr. A, and they brought Mrs. A's living will and her healthcare proxy documentation. And so the palliative care nurse makes copies of that for Mrs. A's medical records. And then Mrs. A tells you that she is feeling much better, she denies pain, she's no longer requiring any pain medicine, and she has benefited from her rehabilitation stay. And Mr. A also reports feeling better since home care services have been implemented, and his niece Angela, whom he has informed, is actually Mrs. A's alternate healthcare proxy, now visits twice a week. She helps drop off groceries and has been helping with light housekeeping as well. So enlisting the help of family has really helped Mr. A, in addition to the caregiver support groups. And these are some online resources where you can learn more about dementia. And they're really great. The first one, www.alls.org, actually has a 24/7 hotline. So if you have questions or concerns, you can call that hotline. It's on the first page of their website. And these are just really great resources to have in your back pocket as well. So if I could just hammer it home, I know we went through a lot of information, but the first take-home point is that palliative care teams are there to help patients and families facing serious illness based on need and regardless of prognosis. So if you are facing a serious age-related illness and you have need, you have symptoms, you have practical spiritual concerns, you have communication needs, palliative care may be right for you, and it would be great for you to look up local resources to see if there's palliative care services in your area that can help you. Then caregivers can provide the best care to care recipients if they take the time to also care for themselves. So to give themselves permission to take that mental break, to refuel, and by working together with healthcare teams to seek out resources to prevent burnout. Completing an advance directive can help honor your wishes for the type of medical care you desire at end of life. And dementia is a progressive chronic disease that is not just a normal part of aging. And if you are concerned about dementia, that you seek out a doctor to help you get started on the path to sorting out whether or not that is something that you may have. And with that, I'm going to end there and see if there's any questions.
Date them because there are quite a few detailed questions.
Okay.
Regarding palliative care and the navigation of resources for the caregiver looking for services for their loved one. Number one, does insurance cover palliative care services?
So palliative care can be offered both in the hospital and in the outpatient clinic. And the majority of palliative care currently is offered in the hospital setting. And depending on where you are in the United States, you may have or may not have access to an outpatient palliative care service. And so depending on where you are, either in the hospital or in the outpatient settings, most insurances will cover palliative care costs.
Okay. If someone feels that they have not been informed about palliative care, what is the best way for them to learn more about the type of services available? Through their physician? Should they talk to their physician, social worker? What would be the best way for them to get those services?
So one of the first things I would encourage them to do is to go online and to look at some of those resources that I had put up earlier. I would say getpalliativecare.org is a really great starting point. And if you have additional questions, then to talk to a local social worker or a trusted physician would be a great second place to go to.
Okay, thank you. So I have a couple other questions. One regarding palliative pain medications. Is there a concern, or what is done if palliative pain medication causes the respiration to slow down? Is that an issue? Is that something that is followed while a person is receiving medication?
So palliative care teams have different members of their teams, and palliative care clinicians and nurses have studied advanced techniques in pain medicine and are trained to apply advanced techniques in pain medication. And one of the biggest mantras of palliative care, especially for older adults, is you start off with a low dose of a pain medication and you slowly up titrate, all the while frequently following the patient and doing clinical checks on them to make sure that they tolerated the medication to the best of the ability. And it is never the intention of a palliative care team member to slow down respiratory rate. The intention is to alleviate pain. And so an older adult in particular may be more sensitive to pain medicine than a younger adult, and they therefore would be followed much more closely than a younger adult.
Thank you. Thank you. Another question has come up, or a request for you to address the issue of people in the church community that are reluctant to send their relatives to residential facilities, the stigma attached to sending someone to residential. How can we help families address that concern?
I think I can appreciate that, and I think that everyone wants their loved one to receive the best care, and sometimes an individual suffers from a disease where the care needs are so great or so complicated that it becomes overwhelming and sometimes even a detriment for that care to be provided in the home setting. And I think that if that were the situation, that I think that a long-term care facility where someone's needs can best be met, especially if they have complicated underlying medical needs, is only within the well-being of their loved one. And that's what everyone wants. They want their loved one to be cared for, respected, and pain and suffering to be alleviated. And if that is within the long-term care facility, then that's where it has to be.
Okay, thank you. We have another question. Well, someone is asking if this PowerPoint presentation will be available, and yes, it will be available later. But what is the best way to get help from a social worker in helping to navigate this process?
So there are many different types of social workers. A great social worker and different. If you see a geriatrician, many geriatric practices will have social workers who specialize specifically in elder care, and those are often located within geriatrician's office. If you see a primary internist or a family physician, they too will have access to a local social worker. So it's best really to start with your primary medical doctor and asking him or her if you could speak to a local social worker. If your loved one is in the hospital, usually a social worker is assigned to him or her, and also using that person as a resource to help navigate along this terrain could be really, really helpful. One of the websites that I put up under the caregiving section also had a lot of local elder care services that you may be eligible for. But it's always great to start with the doctor and ask them to sort of steer you in the right direction.
Thank you for that. Another question regarding healthcare proxy. What are your thoughts on the best person to be assigned as a healthcare proxy? Should it be a family member, not a family member? What are your thoughts or opinion?
So, I mean, that's really a personal choice. I think your healthcare proxy, first and foremost, should be a person with whom you have great trust in, and a person with whom you feel comfortable having discussions about what are your goals, what are your values, and what are your wishes regarding your care. And sometimes those discussions can be hard to have with family members. And so sometimes people find it more helpful to go outside the family and name somebody outside of the family as a healthcare proxy. But that's really an individual choice. And sometimes because these discussions can be so difficult to have, palliative care can also help you navigate these types of discussions. And that's what palliative care doctors are there to help you do. Do things like select healthcare proxies. But it's really an independent choice. What I have clinically seen most frequently is most people end up appointing family members as their healthcare proxies. But first and foremost, family or non-family member, it should be somebody that you can trust.
Absolutely. Very good point. Last question. Does Medicare usually pay or cover for home care?
Medicare covers certain home care services, and that's something that a social worker could also help you sort of go through, what you would be eligible for under your Medicare plan, because there's a lot of different caveats to Medicare, and so a social worker could really help you go through what services you would be eligible for.
I believe that is all the questions I have. Dr. Litrivis, before we close, is there anything else you'd like to add?
I think that's it. Thank you so much for having me on.
Well, thank you very much for your wonderful presentation. And again, for everyone listening, this workshop was recorded and will be available for viewing in about a week. We will notify people on our Facebook page and through our email list when it will be posted. You can sign up for the email list and like our Facebook page from our website at www.family.goarch.org. Also, please note that our next webinar will take place on Tuesday, March 1st at 1:30 p.m. The topic will be Preparing for the Great Lent, a panel discussion. Again, thank you for joining us today, and it is our hope that you will pass these workshops on to people who you think are interested in this topic. Again, thank you and good day.